Hello and welcome to this episode of Recitals. We'll be discussing social issues. Today we'll be discussing Tamil Nadu Hooch tragedy, the National Health Claims Exchange, and Delhi water crisis. Let us discuss the Tamil Nadu Hooch tragedy. It's actually a recurring problem in the country that over a period of time, several people have fallen prey to poor quality alcohol, which is called hooch. Why does this happen? What are the reasons and how frequently has this happened? Let us take a look at that. But more importantly, what recently happened was in Tamil Nadu, there was a case, or rather there was an incident in Kallakurichi where at least 34 people died and about 100 others were seriously hospitalized for very serious reasons. Now, what the Tamil Nadu government has said is that there's going to be a compensation of about 10 lakhs for the people who died and about 50,000 rupees would be given to each of the people who has been hospitalized. Now, what we need to know is what is hooch actually? Why do we use this word? Hooch comes from the word Hoochino. It's a native Alaskan tribe that was known for making very strong alcohol. So the word hooch came from there and people started using for locally made alcohol. Now, unlike branded liquor that is available in what are called foreign-made liquor shops and others, they're produced under very serious, very stern conditions, and they're produced under, there's a lot of quality control that goes into that. Unlike that, hooch is generally produced in very crude settings. And that is where the problem starts to, this is basically illegally made, and that is where the problem starts to come. Now, there are no quality checks, nothing. This is basically illegally done, so there can't be any quality checks. Now, coming back, like all alcohol, hooch is produced using two basic processes. One is fermentation, the other is distillation. Now, hooch is produced using distillation of fermented mixture. Generally, what they do is they take locally available yeast. Yeast is actually what creates fermentation. We use it in practically everything. You have bread, that's basically yeast allowing it to grow. You make a dosa that's basically been fermented overnight. So basically, yeast is kind of central to everything. Now, particular types of yeast, they're used in fermentation process for creating alcohol. So what they do is they consume sugars and the byproduct that's produced is alcohol. Now, basically, alcohol production has two processes. One, fermentation, like I just said. The second process is distillation. Now, what happens in the case of hooch is, we always have ethanol, which is consumable alcohol, that is there in practically everything. Now, it also contains, hooch also contains methanol. It is CH3OH. It's a different form of alcohol which is highly toxic to human beings. Now, during distillation, ethanol and methanol both are produced, and both are produced in certain concentrations. This, if done incorrectly during the process of distillation, can lead to an end product that has high quantities of toxic methanol. Now, what should we know about the alcoholic drinks? Like I said, the chemical formula for methanol is CH3OH. This is something you may want to remember. Now, methyl alcohol or methanol is the simplest form of alcohol, and it's a colorless, odorless, colorless, flammable liquid, and it is used in a variety of manufacturing processes. Actually, that's the reason we have hooch tragedies, because methanol is very easily available and it's used in industrial processes. We use it for making hydrogenation of carbon monoxide. It is used as a solvent in industrial processes. It is used for making plastics. It's a very widely consumed product for industrial purposes, because of which methanol is very easily available. It's needed actually for a variety of industrial uses. Now, why do bootleggers use methanol? They know that this is toxic. Why do they use it? That's because the general way of making country liquor is hooch or country liquor is they either ferment jaggery or they use what is called fruit extracts, or things that are thrown away after fruits are eaten, things like that, and they ferment them. Now this fermented mixture is generally kept in earthen pots, and it's often buried underground to fasten the process of fermentation, and to quicken the process of fermentation, which allows them to actually make. See, basically what they're trying to do is quicken the process of fermentation. This allows them to quickly make seals. Now, fermentation can take just a few days or weeks. When bootleggers are hard-pressed to produce stock quickly, they add controlled addition of methanol. This is where the problem starts. Because they're hard-pressed for time, they start using methanol as an additive. It's already readily available, right? You don't have to wait for your yeast to consume the product you have put and create alcohol. You can just add methanol, and methanol is poisonous. Now, the addition of methanol, what it does is, it gives a certain flavor and adds to a kick, making the liquid highly intoxicant, and sometimes even acid is added to make the kick more effective. Now, what we need to remember is, generally, for example, take for example Scotch. Scotch, when people buy it, it generally, you have something like 10 years written on it, 12 years written on it, or 15 years written on it, 25 years. What this means is, they kept it in barrels for that many years. Now compare that to the kind of pressure that a bootlegger has. That is the reason they end up adding methanol. Now when does this become hooch? Now what happens is, even 40 ml of methanol, when it is ingested, it becomes fatal. Just 40 ml. Thus, when it is concentration is increased even by 5%, it can become extremely dangerous. Now, how does methanol affect the body? Goes into the stomach, and basically it is metabolized into formaldehyde, and then it forms formic acid. Now, once this happens, it can lead to disastrous consequences. Now, the effects kick in just a couple of hours, and the person starts to feel dizzy, can feel nauseous, can feel like vomiting, can have severe headaches, there can be shortness of breath. Now, the problem is, many of these symptoms are very close to the symptoms you'd have when somebody has alcohol. So that's where it becomes very difficult to actually address this problem well in time, so that we can prevent deaths. That is where the problem lies. That is one of the problems, rather. Now, how do we treat methanol poisoning? The idea is, ethanol is used to treat methanol. Now, this is an important idea. We'll come to it again. This is the most important thing you need to remember. Ethanol is used to treat methanol. So basically what happens is, injections such as fomepizole are used for the treatment. The most effective treatment is, diluted ethanol is given to the person through an intravenous injection, and then the blood is basically, what they do is, the person is given a dialysis treatment, and if they have very severe symptoms, they use even dialysis to basically reduce the amount of methanol in the bloodstream. Now, like I said, these are the symptoms of methanol, how methanol affects the body. They can have lack of coordination, they can have headaches, they can have dizziness, there can be abdominal pain, they can be vomiting, they can be breathing difficulties, and in extreme cases, it can lead to coma, it can lead to nervous problems, they can have paralytic attacks, and they can even be death. But the problem, like I said, is, if you see these things, these are things very commonly associated with just normal alcohol consumption. Now, how can methanol poisoning be treated? Now, once methanol is ingested into the body, it takes some time to completely eliminate it. And there are two immediate ways to treat methanol poisoning. One is administer ethanol, that's of a pharmaceutical grade. Generally, healthcare workers do this. Now, ethanol competes with methanol for the ADH. For ADH enzymes, as a result, methanol is stopped from being metabolized by the body. So you don't have formaldehyde and formic acid being formed in the body. And that can save a person's life. Now, the other option is to administer an antidote called fomepizole. This is again an important thing. Kindly do remember that. Now, which slows the action of the ADH enzymes, causing the body to produce formaldehyde at a rate that the body can quickly get rid of, preventing the deadlier effects from kicking in. Now, regulation of methanol in the country. Methanol is a Schedule 1 of manufacture, storage and import of hazardous chemicals rules 1989. They include methanol in it. The Food Safety and Standards Regulations 2018, they strictly have conditions about how much of methanol is allowed to be stored in a purse by different liquors. There are about where you can keep it, how much of it is allowed, all that is determined. For example, the values span a wide range depending on the kind of alcohol that's there, including from absent in some, such as coconut fenny, to 50 grams per 1,000 liters. For 100 liters in country liquor. Now, the Indian standard IS 517 applies to how the quality of methanol is to be ascertained together with the Tamil Nadu denatured spirit, methyl alcohol and varnish rules 1959, which says the signage that should be there, how methanol packaging should carry and things like that. Now, just going back to what we just discussed, alcohol is produced basically using fermentation and distillation. For example, in the case of wine, it's basically from grapes, right? Wine is produced from grapes. Grapes are fermented, we have wine that comes out. And the same product, grapes, if they are grapes are also used for making brandies. Now, when you distill it, we have things like brandy. So basically, you have both fermentation and distillation happening. You know what is distillation? Basically, things are heated up, that evaporated, then the evaporated liquid is collected separately. Now, distillation is important because more of the sugar getting converted into alcohol, the conditions can become toxic. So to prevent that, distillation is carried out. Now, the other thing is, alcohols also have a concept called, we call the word proof. You must be seeing the word proof. There are a couple of concepts you need to know. One is proof, the other is angel share. These are all terms you'll come across when you, Proof is basically how much percentage of alcohol you have. This is basically percentage of alcohol in any drink. Could be 3% in beer, 3% in beer, to all the way up to say 45% for whiskeys. And you also have certain other drinks which have up to 75%. They're generally not consumed much. Now, the other idea I want you to know is there's a concept called angel share. It's kind of thing that ends up in, prelims actually, some weirdly related thing to this. So angel share is basically the percentage of spirit that is lost due to evaporation. This is basically, now this doesn't happen with hooch, and this is not a concept that's used in hooch or illegal alcohol and all. I mean, it's just not there. This is a concept that's used in proper production of alcohol, like say, for example, if you're making a whiskey or something like that, you'd use this concept, because this is basically, angel share is losses due to evaporation. So what this effectively means is, the spirits that are kept for longer time, say alcohol, Scotch is kept for 25 years, then naturally the angel share of that is going to be higher than a Scotch that's kept for 10 years. So this is an idea you should just remember, that this concept is used, that's all. Now, what are the adverse effects of ethanol on the human health? Ethanol is metabolized in the liver and the stomach, and then we have basically what happens is aldehyde dehydrogenase enzymes transform acetylide into acetate, and then the adverse effect of alcohol consumption, from the hangovers to cancers, you have a very wide range of effects. Now this is basically due to this one thing called acetaldehyde. This is basically what is creating the problems in terms of health. Now, contrary to common beliefs, there are actually these myths that you should have a little alcohol a day, a little wine a day, and that improves your health. There is absolutely no scientific evidence for that. In fact, the WHO has come out with studies and other things, and they have said that there is absolutely no basis for saying any amount of alcohol consumption is good for health. So that is basically an idea that has been used by the alcohol industry, and it's not valid. There is no quantity of alcohol which consumed on a regular basis can give you health benefits. There isn't anything like that. The only quantity you should be consuming is 0. Now, this we already discussed. Now, this is what I was saying at the beginning of the lecture. Since 1976, there's a long list of huge tragedies in the country. This is the one we just discussed, Kallakurichi in alcohol poisoning. Then 2022, we had a case in Gujarat. There were again 100 people died. Then we had 2019 a case in Assam. We had 2019, 100 people died in Uttar Pradesh and Uttarakhand. See, 100 people died in Uttar Pradesh and Uttarakhand. Here also about 100 people died. So, and 2017, 6 people died in West Bengal. 2015, there was in Mumbai, there was an alcohol poisoning incident. So you see, we have data from, I put up a list for you from 1976. 1976, about 100 people died in Gujarat. And there have been, this is a constantly recurring tragedy, all because people are very, eager to make quick profits, and they add methanol. And methanol eventually can kill people. Now, coming back, has the government done anything about this? Yes, there have been at least 3 commissions. There have been more than 3 commissions, but these are the 3 important commissions. 1978, we had Justice M.N. Miyabhoy Commission. Now, there was a Justice A.A. Dave Inquiry Commission in 1990, and they basically suggested that we have a better way of managing and regulating the sale of methanol, because that was the crux of the problem. Then there was also a Justice Mehta Commission that suggested that the government must decide the use of methanol in terms of production, and there should be random inspections and they recommended that specific rules must be made for the transportation, storage and things like that. So the government has actually stepped in several times, but this is the problem is people want to have alcohol. Most of the alcohol is quite expensive, and people look for cheap alcohol. And cheap alcohol is available only from bootleggers, and bootleggers want to make a quick profit. The way to make a quick profit is to add methanol, and that's where the problem starts. Now, there is also a slightly related idea that we need to discuss when we talk of Hooch tragedies. There's also a problem of alcohol consumption in the world. Not to take moralistic positions of saying, alcohol is terrible, or a Gandhian position that would say ban alcohol everywhere. Like Gujarat has a ban on alcohol, right? Thanks to the Gandhian philosophy that's followed there. But the Global Status Report on Alcohol estimated that 2.3 billion people in the world are currently alcohol drinkers. And the consumption varies across regions of the world. And more than a quarter, 27% of all 15 to 19 years old are currently alcohol drinkers. And the highest in this age group, the number of people who are having alcohol in the 15 to 19 age group, 44% of them are in Europe, followed by the Americas and Western Pacific, both at 38%. Now, WHO has started an initiative. This I want you to remember. This is a useful idea. You could probably either use it in the mains or it could end up even in prelims. So please do pay attention to this. This is called SAFER. This word I want you to please remember. This concept I want you to remember. Please remember this. This is a useful idea. This is a strategy started off by the WHO to basically prevent alcohol consumption and alcohol abuse, one might say. So what it says is, SAFER provides a 5 high-impact strategy. Okay, 5 high-impact strategic actions that are prioritized to promote health and development. So first thing is called strengthen restrictions on alcohol availability. Second, they've said that advance and enforce drink driving countermeasures, facilitate access to screening, brief interventions and treatments, enforce bans or comprehensive restrictions on alcohol advertising, sponsorship and promotion. Now, for example, in our own country, very severe rules about alcohol advertising, sponsorship and promotion. We really don't have alcohol advertisements in the country. It's not allowed. I mean, in fact, many times you'll be seeing even on TV or anywhere, whenever somebody is consuming alcohol, even in a work of fiction, you have a ticker that says that alcohol consumption is dangerous. However, the government is trying to plug a loophole where online platforms are not been following this rule. So they're going to plug that very soon. So that is one thing. So we have a very clear ban on sponsorship and promotion of alcohol. Now, the other thing they've said is increase the prices on alcohol through higher excise duties and all that. So all of these things, we are doing this as a country. So remember this idea, SAFER. SAFER is a strategy that has been started by the WHO. So this is what you need to remember. Now, we'll just wrap up this topic with one important idea. In every Hooch tragedy in India and across the world since 1945, the poison has always been methanol. Like I said, the biggest problem is methanol. It's always methanol. The culprit is, now many doctors around the world, they wrongly conclude that it is chloral hydrate. So they administer remedies that do not help. This is a common problem. So these two things you should remember. This is a wrong diagnosis made across the world, because of which many people lose their lives. Now, ethanol successfully competes with methanol for the enzyme ADH that creates the components that leads to disastrous effects, which basically it leads to creation of formaldehyde, like I said, which kills, blinds, cripples people. So the idea that's to be remembered is, if ethanol is consumed, methanol will not break down and will pass out harmlessly from the body. So the idea is, poison is methanol and the antidote is ethanol. So this is what it is about. Let us discuss National Health Claim Exchange. The Health Ministry and the Ministry of Health and Family Welfare and the Insurance Regulatory and Development Authority of India, IRDAI, they are collaborating to launch the National Health Claim Exchange. So what is the National Health Claim Exchange? Why are we trying to have this, and how will it impact us? How will it impact the nation? Is it a good idea? Is it necessary to do this? And how is it going to transform the country? Well, let us discuss that. Now, this is basically a digital platform that will enable patients to access quality healthcare quickly and reduce out-of-pocket expenditures. We have discussed the idea of out-of-pocket expenditure in an earlier video. So please do visit that. The whole, we'd say that the focus of the government has been on reducing out-of-pocket expenditure in the case of healthcare. So what is out-of-pocket expenditure? Basically, when somebody is hospitalized, anything that is not covered by their healthcare provider, say the insurer, maybe it's the government that has paid for it, or the state government that has paid for it, or you have a private insurance, whatever is not covered by that, you're going to pay out of your own pocket. That is called out-of-pocket expenditure. This is a very important concept because this eventually decides, in many cases, the distance between somebody staying, financially healthy and going bankrupt. So the effort of the government overall has been to reduce out-of-pocket expenditure in the case of hospitalization. So that is an important idea. Please do visit one of the previous lectures where we have discussed that when we are talking about health insurance and things like that. Now, NHCX, that's the National Health Claim Exchange, will connect government companies, health service providers, and government insurance scheme administrators, and it will streamline health access and claims. So how is it going to happen? Now, the National Health Claim Exchange, this is an important idea. It's a communication protocol actually that facilitates the exchange of health claim information between the payers, the providers, beneficiaries, and other entities. So it's basically, what we have to remember is that the NHCX is a communication protocol. That's the most important thing that you need to remember. Now, it is designed to be interoperable, machine readable, and auditable, verifiable, and this will ensure that accurate and trustworthy information is exchanged between these people, between the payers, that is the health insurer, between the provider of the health facility, the beneficiary, the person who is hospitalized, and there are also other players like the TPS, the third party, third party administrators. We'll discuss the third party administrators in a minute. So basically, this is what it is. Now, this is a crucial part of the government's goal and the IRDAI's goal of health insurance for all by 2047. Now, it aligns with the IRDAI's goal of insurance for all, and will also ensure that the insurance support is streamlined, it is paperless, and there are secure interactions between all the people who are involved in this. Now, what is the background of this? How did we reach here? You see, currently what happens is, it's a painstaking process to track claims and reconciliations. People really go to a hospital and they don't always get their insurance immediately. There might be a lot of disputes, there may be a lot of problems. Many times they have to pay out of pockets. Then they have to keep running after the healthcare, the insurance provider, especially if it's a government entity, for months after months after months, hoping that their claims are settled. That's a serious problem. Now, the other thing is, the insurers and TPAs, we'll discuss this in a second. Like I said, TPA, get uncoded data, and they have to digitize it themselves, relying mostly on manual adjudication and limited fraud analysis. Now, this is not how it happens in the rest of the world. Now, what are TPAs? TPAs are what are called third-party administrators. Okay, what are third-party administrators? Whenever we talk of insurance, the person who's purchasing the insurance is the first party. The second party is the person who's selling the insurance. Now, the third party is the one who manages claims, who takes care of hospitalization, who takes care of policy management, can even take care of underwriting. So this service is not always provided by the insurer directly. There is another entity which takes care of it, which is called a third-party administrator. Now, in our country, they have to be IRDA registered. They have to be registered by IRDA. They have to be given a license by IRDA to operate, and then they can operate. So we have a few examples, like we have MediAssist. This is one TPA. I'm giving examples of TPAs. So there is one called MediAssist. Then there is MD India. So these people basically they act as intermediaries between this insurer, between the beneficiary, the hospital, and everybody. So they are called third-party administrators. Now, the other problem in the current context is patient experience, like I said, for claims is cumbersome, and there's minimal communication, and there isn't enough transparency on the status of pre-authorization, and there are very long waits. Now, the other thing is regulators receive delayed and incomplete data because nothing is digitized right now, and there's a lack of coding that leads to limited analysis. So even if people are receiving in PDF files, it's not really coded properly, so we can't analyze the data. So this is one of the problems. Now, who are going to be the stakeholders in NHCX? One is going to be the payers, that is the state health agencies, the insurance companies, or the TPA. The providers, who are the providers? They'll be the hospitals, clinics, diagnostic chains, labs, pharmacies, all the people who actually give you healthcare. And then, most importantly, the insured person, which is people like us. So there'll be PMJ beneficiaries, there'll be health insurance policyholders. So these are the stakeholders in the NHCX. How does health insurance currently work in the country? How does the health claim settlement process happen in the country? Now, what happens is, you have a beneficiary walks in with an insurance card, and the hospital then submits a claim. They fill up the claims by hand, scans are they upload the supporting documents, then they upload it to multiple portals provided by insurance companies or TPAs to raise and track claims. So this is what happens. So this is what you have to raise a claim, and then you have to track it continuously. After this, they're submitted to multiple insurance companies. Somebody may have more than one insurance company. A person might be taking 5 lakhs from one place, another 5 lakhs from some place. It depends actually. Now, these companies will then adjudicate your claims. They'll see whether the claims are valid, whether they're actually covered under the insurance a person has purchased. And then they digitize and verify the forms after this, and then manually they adjudicate each claim. So you can see it's a pretty cumbersome process. Doesn't really benefit anybody. Now, like I said, the current process is quite cumbersome. Patients have to provide their details to the third-party administrator or insurance company when they visit the hospital. Then the PMJ beneficiaries, they have the same PMJ card. They have to show that card. And then hospitals access specific portals for actually settling specific claims. In India, most of this process is done manually. Unlike in the developed world, where 90% of the process is adjudicated, auto-adjudicated. So basically things are auto-adjudicated in the developed world. This is what we want to change. Where now we have almost 100% manual adjudication. We want it to be auto-adjudicated. So that is where the change is going to come. Now, over the current process, like I said, in the current process, patients who visit a hospital, they have to take their cards. Then the whole process is quite cumbersome. And pre-authorization claims, then the TPS, and many developed countries, like I said, they actually use auto-adjudication for this. Now, what are the challenges in the current processes? Current process lacks standardization across the ecosystem. Like I said, everybody has their own way of doing it. In fact, even the data that we get is not easy to use. Most of the data is done through PDF and manual methods. Then there are no established health standards about how much do you pay, how do you do this. It's kind of, it's actually not standardized properly. None of the processes are standardized. There are no time limits for anything. There is nothing very clear about this. Now, processes significantly vary between insurers, TPS, and providers. All this basically leads to a lot of problems for the beneficiaries, which is what we are trying to minimize. Now, to address these challenges, what the National Health Agency, the NHA, the NHA was established in 2019. It works under the Ministry of Health and Family Welfare. Okay. Now, this was basically established to help us with our with the new PMJ and other things that we launched. So this is a relatively new agency. So what they have said is the NHS protocol has been published now, and we are basically waiting for people to come back with ideas about it, to give feedback, and then the NHS is actually still open to discuss and improve the system to make it better. Now, the idea is that it serves as a blueprint for each aspect of the envisioned claims network. Now, this would mean that technology and there'd be vendor neutrality, there'll be adaptability to change over time as per the needs, and the promotion of innovation and inclusion. So this is what the NHCX is hoping will happen. Now, the other thing that NHCX is trying to do is leverage the ADBM building blocks. What is ADBM? The ADBM is Ayushman Bharat digital mission. Whatever we have gained from that, we want to use that into creating this. Now, we have Ayushman Bharat health account number. This is going to be used for the purpose of uniquely identifying citizens. Now, the healthcare facility registry is a single source that can be used for basically identifying people and establishing claims. Now, the health professional registry, it's a verifiable database of all healthcare professionals across the country. All these are in place, and they will just keep improving over a period of time. So using this as a building block, NHCX is going to function. Now, what are the building blocks of the Ayushman Bharat digital mission? We have the health ID, we have a health information exchange gateway and consent manager. Then we have the healthcare professionals registry, and we have the health facility registry. So these are the building blocks of the Ayushman ABDM. When we say the building blocks, those are the building blocks. Okay. Now, what is the future of this going to look like once NHCX comes into play? How is it going to work? Like we've already described how it works currently. Now, how is it going to work in the future? Now, we have the digital KYC with the ABHA, that is the Ayushman Bharat health number. Everybody will have one of this. Now, the hospital, once a person goes to the hospital, they would actually submit this to the hospital, and the hospital then submits a claim. Like even now they're doing that. Now, there will be a common claim standard format to be used across government and private health claims. This will be defined by NHA, the National Health Agencies. And then they will validate the metadata. Both the sender and receiver information will be validated. And the National Health Exchange comes into play here. Now, the insurance companies, there will be routes designed to designated insurers and TPS, third-party administrators. They'll digitally verify the forms and auto-adjudicate the claims and manually adjudicate some claims where the things are not clear. Now, the idea is that this whole process should take about 3 hours time. So, we're talking about months upon months to just merely 3 hours. So, this is what the change is going to be like. Now, how is it going to benefit the stakeholders? We already described who the stakeholders are. For the beneficiary, the person who's actually hospitalized and suffering, reduced waiting time. Like I said, from months upon months, we're going to reduce it to 3 hours. Now, there's going to be a faster pre-authorization and discharge approvals from insurance companies. Discharge processes are generally quite problematic and painful because of delayed claims adjudication. And they're going to reduce the cost of insurance premiums. and more types of claims in the future will be available for the beneficiaries. Now, in the case of providers, there will be a single payer network. There will be universal claims format. Nobody has to do the whole thing manually anymore. There will be faster payments by payers. There will be improved patient experience, because of which they'll continue buying more insurance from people. There will be a better visibility of claim status. It won't be like you submitted a form and you really don't know what has happened, which is what happens now. Because once you've submitted, you very clearly know where things are going, because everything is now standardized. Now there will be paperless operations. Right now everything is done manually and everything is going to be digitalized. Now for the payers, that is the insurance companies, there will be a reduction in overhead operational costs. Just imagine the amount of paperwork that's going to be saved. They'll enable new processes, rules for auto adjudication. There'll be control of fraud and abuse prevention. Fraud is also the problem, because of which adjudications are in place, because of which everything gets delayed. Now there'll be a reduction in claims processing cost per claim, because everything is going to be done quickly and automated in an automated way. Things are going to be much more easier. There will be paperless operations. Better quality of data will be available for both the industry and the regulators. This will help. Basically, this completely changes everything for everybody. Now, what are the expected working? How is it supposed to work? It will centralize health claims. Right now, like I said, it's basically a disparate, completely disjointed, chaotic system which just about functions in a inefficient manner. Now, reduce administrative burdens on hospitals that currently use multiple portals. Hospitals can better utilize their resources. Now, other thing is, there'll be, right now 12 insurance and 1 TPA have completed this is slightly older data, NHCX integration. Now, a new timeline mandates that all cashless insurance claims must be processed within 3 hours. Like I said, 3 hours of receiving the discharge from the hospital, discharge or authorization from the hospital, claim must be settled. So it makes it very easy for people, which means that they don't have to pay out of their pockets anymore. Now, the insurance regulator has given providers a deadline of 31st July to implement the necessary changes and necessary systems and processes, and to basically start using the new system. Now, what are the incentives under NHCX? It promotes digital health transactions and the digitization of patient health records. The National Health Authority introduced the digital health incentive schemes in January 2023. Now, according to the Health Ministry, under the DHIS, hospitals will receive a financial incentive of 500 rupees per insurance claim, or 10% of the claim, whichever is lower. So this is a huge thing for the hospitals. Now, what why is NHCX being brought in? Like I said, we have described this in fairly adequate detail, but basically there was a paper that was called Health Insurance Coverage in India, Insights for National Health Protection Scheme, which highlighted that hospitalization cases are the highest with private insurers, 54.4 per 1 lakh persons overall. And in urban areas, what we are seeing is there are more health claims from the government and state funded schemes, and in the rural areas there are more insurance claims from the private providers. So what we see is there are 60.4 claims per 1 lakh per people in the case of urban areas, and in rural areas there are 73.5 claims per 1 lakh people. Now, urban areas have generally higher inpatient cases compared to rural areas. Now, what are the challenges that we face when we come to this? One of the challenges is improving the relationship between hospitals and insurance companies. Now, the health insurance in India accounts for 29% of the total general insurance premium income in India, which is not actually that small a number. The main challenge is improving the relationship between hospitals, Insurance companies, it requires basically digitalization efforts, it requires IT system upgrades and workforce training. All this has to be done because once we are adopting a completely new system, these three things must be in place. Now, the other issues are discharge delays and miscommunication that has to be overcome. Now, this happens many times due to the mistake of the hospitals, or there is some miscommunication between the patient and the doctor and the hospital management. So that has to be overcome. Now, the most important thing when we talk of insurance is building trust. Building trust among policyholders on efficient service delivery. That is a big stumbling block if this 29% has to go up. Now, what are the benefits of national health claim exchange? There is interoperability, like I said. Then there will be efficient claims processing. Then there will be standardized healthcare pricing. There will be reduction in claims processing costs. These are all inevitable outcomes of this. Then now what has happened, this is the latest update we have about this idea, about this topic. 33 major insurance companies have, those who are offering health insurance in India, they have joined the NHCX, which is a pretty good number of people. Like I said, they started off with a smaller number because also there is a deadline approaching. 33 of them have joined for the government. They have joined the platform developed by the government and they joined the NHCX. So 33 major companies have already joined it. So this is where it stands right now. And this should be a major change in the years to come. And it should really be useful for everybody. And I do hope you have a good idea of what this actually is and how it's going to impact the country. I hope the discussion was detailed enough. Delhi's water crisis. What are the causes? What are the impact and what are the solution? I mean, all of you are aware, we just went through a scorching summer and we had really, high temperatures for an extended period of time. I mean, we had continuously temperatures of 45 plus, there were 47, some places in the country hit even 50 and wrong readings of 52, 54 in some places. But otherwise, in fact, there was a wrong reading in Delhi that said that it was about 52 degrees, but that day it was about 49. While this was happening, inevitably, as expected, there was a very severe water crisis in Delhi. Now, why did this happen? How can we overcome this? Is it a Delhi-specific problem? How is India placed in terms of water resources? How is the world placed in terms of water resources? What are the areas that are going to be stressed in the future? How is the country going to be stressed in the future? How are we drawing water right now? Let us understand these ideas. We'll start off with Delhi, talk about the country, and then we'll try and take a look at the world. Now, what happened was there was a severe shortage of water in Delhi, like I said, and the Supreme Court directed the Himachal Pradesh government to release 137 cusecs of water that it had in surplus. And they also asked Haryana to do the needful to resolve the drinking water crisis that had developed in India. Now, just an update. Right now, we had some reasonably good rains in Delhi, and the city actually had a bit of flooding. Like it's almost become an annual ritual where you have a bit of rains and the whole city is flooded with water. So that has changed, but still we need to understand what happened in the summer because it's going to come over and over in the years to come. Now, what happened was the Aam Aadmi Party, which runs Delhi, they approached the Supreme Court alleging that the BJP government in Haryana was stopping Yamuna's water while there was a surge in demand for water in Delhi. Now, where is Delhi's water coming from? Now, Delhi gets most of its water from the Yamuna, Ravi Bias and Ganga rivers. So these are the three major sources from outside that come to Delhi. For the Ganga, via the upper Ganga canal in Uttar Pradesh, Delhi receives about 470 cusecs, roughly that's about 254 million gallons per day of water. There are two channels, they're called carrier-lined channel CLC Munak and the Delhi sub-branch called the sub-branch canal that enters from Haryana. Uh, and they supply about 1049 cusecs with water from the Yamuna and Ravi BS rivers. Now the Delhi Jal Board also takes water directly from the Yamuna and supplements its river water supply with groundwater drawn from Delhi's tube wells and wells. Now, according to the Composite Water Management Index released by the Niti Aayog in 2019, 5 of the world's 20 largest cities under water stress, they are in India. So it's a pretty serious problem actually. Now, let us just put things in context. Why is this happening? Primary reason is, one of the most important reasons often overlooked is, or rather not overlooked, I'd say it is actually stressed over and over, is water wastage. The average Indian wastes about 30% of their daily water requirement, which is to say, there are 3 people in a house. A 4th person could, the amount of water they're using, a 4th person could actually sustain without adding any water. It's as much as that. It's actually quite an amount of water. When you think that every glass of water, look at it like this, every 3 glasses of water you're drinking, think that you're throwing away a 4th. That's the amount of water we are wasting on a regular basis. Now, 49 billion liters of water is wasted every day in India. And 33% of Indians keep the tap open while bathing and brushing. It has been, said over and over, keep the taps closed when you're actually brushing or when you're actually bathing. But we don't do that because of 33% of people are still not doing that. And 30% of water requirement is wasted by people, like I just said. 3.6 liters of water is wasted per day if you have a leaky tap or a leaky faucet. A tap that just seemed to be giving out 1 drop, if left like that for an entire day, uses up 3.6 liters of water. That's a lot of water. That's almost 2 days of drinking water for a person. Now, India is home to nearly 18% of the global population, but we have only 4% of the globe's water resources, which already means that we are stressed in terms of water requirements. Ideally, we should have 18% people, 18% water. It's not so. We have only 4% of the world's drinking water, freshwater resources. Now, India's per capita, these are ideas I want you to pay attention to actually. Now, India's per capita water availability is around 1100 cubic meters. This is well below the globally, recognized threshold of 1700 liters. So what we have is 1100 cubic meters of water. In the world standards, what we say is, if you don't have 1700 liters of water, 1700 cubic meters of water per person, then you have water stress. Then the situation is actually under water stress. Now, if this 1100 falls below 1000, we are entering a situation of water scarcity. So we are very close as it is, as of today already, in terms of entering a situation of water scarcity as a country. Around the world right now, there are 5,500 cubic meters of water per person available. So we really have a lot of shortage of water in the world, in the country as such. And Delhi is just a symptom of this severe problem. It's just that when it's happening in Delhi, the country pays attention. But the situation is drastic across the country. That's what we need to remember. So remember these 3 numbers. 1100 cubic meters is what we get. 1700 is the water stress point. Anything under 1000 is water scarcity. Now, in 1970, per capita availability in India was 2.5 times what it is today. And this has steadily fallen. So in 1970, we had 2,594 cubic meters of water availability per person. Now, by 1990, it came down to 1661. So basically, this water stress point, we crossed somewhere in around 1980, 1988, 99. So that's where around, between 85 and 90, let us say, we crossed that point. And right now, we are actually in a serious problem in terms of water resources. Now, this is how the world's availability of water has changed over the past few decades. So if you take from 1970, the world, if you take for the entire world, in the past 50 years, if you take for 1970, we had 11,288 cubic meters of water availability. In India, then already we had 2,594. So we already had much less water than the rest of the world. So you see, it kept on dropping to the point right now it is 5,500 for the entire world and a mere 1,036 for us. Now coming back, this is how the water scarcity is across the country. Now northern and northwestern India are more stressed for water than the other regions. Now there's also another problem. If you see this map, this part of the country is actually getting drier and drier than the other parts. Now the other thing we also notice is these parts of the country are drawing out more water than the other parts. For example, Arunachal Pradesh is taking 0.4% of the groundwater that it has. Now, more water than it has. Punjab, Haryana, Rajasthan, Delhi, Uttar Pradesh, we're all taking about 101% more water than it has in case of Delhi. Rajasthan, it's 150.2%. So we are drawing out a lot of water, which means that there isn't enough water coming out through rain and other things which will allow water to be recharged. So we are actually setting up for a much more severe problem over a period of time. Now, this map, remember, it's a fairly serious issue we're talking about how much of groundwater is being extracted in excess of what should be there. This is also in excess of what they should be, but this is just 0.4% in the case of Arunachal Pradesh. In the case of Rajasthan, it's 150.2%. So it's a fairly serious problem. So some states are doing slightly better, but they're also extracting. Everybody's extracting more water than they should. Now, this is the big picture that we are talking about. India is home to 18% of the global population, but we have only 4% of the water resources. Now, per person, like I said, we have 1,100 cubic meters, and very quickly getting to the 1,000 cubic meters per person, which is water scarcity. Now, what are the reasons for this situation that happened in Delhi? The primary reason, like I said, is over-extraction of groundwater. That map that we just saw. Over-extraction of groundwater, we are just drawing out more water than can be recharged over a period of time. Very quickly we're taking out water, and there isn't any way that water is getting recharged. Now, according to the economic survey of 2023 and 24, Delhi has a daily water requirement of 1,290 MGD, of which the Delhi Jal Board currently produces about 1,000 MGD, and the gap is met by Delhi's groundwater. That is one of the primary reasons. So we're drawing out more and more water. Now the other thing is pollution of water sources. There are high ammonia levels, more than 2.5% parts per million in the Yamuna. For long have contributed to very poor water. Basically, everybody knows Yamuna is not really a river by the time it reaches Delhi. It has turned into a complete sewage. It's one of our sacred rivers, and see what we have done to it. Till almost Agra, the water is actually hardly usable. There's hardly any life in the river. We have killed off the river actually, for a river that we actually worship. Now, there are numerous drains and rivulets that discharge toxic waste from small and medium industries into the Yamuna River, because of which the water quality keeps getting worse and worse. Now, there's also another thing, the impact of climate change. We're all actually talking about impact of climate change, but now we are starting to witness it in our lives every day. So what is happening is, the impact of climate changes in the future, all the way probably from Iran till the beginning of, say, the end of the Gangetic belt, there's going to be probably some kind of a arid semi-desert because everything's going to go dry. Now, the impact of climate change is also that there won't be enough water available because there's going to be floods which devastate the land. And once you have floods, the capacity of the land to actually hold on to water is taken away because the topsoil is taken off. So then the land will dry out faster. And then we have prolonged droughts. So we are going to see this. And then you have extreme heat when we actually need more water and water won't be available. That's exactly what we are witnessing, what we witness in Delhi right now. We're actually witnessing the beginning of climate devastation. In terms of economic impact, it's estimated that Delhi will lose about 2.75 trillion by 2050 because of climate change. So these are the reasons. Now, what are the other reasons? Rising temperatures and erratic precipitation patterns, they actually pose significant challenges to the water resources that are available to the city. There is inefficient water management. Now, this is one of the things that the opposition actually said, that the water is not being managed efficiently enough. Now, the Central Water Commissions, they're saying that their role is inefficient in managing the 3 barrages in Wazirabad, ITO and Okhla. They indicate that they are in very poor condition and there is no transparency among Delhi, Haryana and Uttar Pradesh about the management of these places. Then we have inter-water state disputes. This is happening across the country. You all must be familiar with the Kaveri water dispute as well. And Haryana says that Delhi is drawing more water than it's actually allowed to. And the amount of water that's allotted under various agreements, they're saying that Delhi is drawing more water than this. And Delhi's population continues to grow. So we'll need more water and more water over a period of time. Now, the water treatment plants, their capacity has not been used fully because we didn't have enough water coming into there was not enough water in the Yamuna because of a deficit of rainfall. We didn't have any pre-monsoon showers in Delhi this time. Because of that, the Yamuna didn't have any water that could be used to actually treat the water. So the water treatment plants were not being run properly. So those are the main reasons because of which we had a water scarcity in Delhi. Now, what are the challenges posed by water scarcity? We have health issues when there is reduced availability of clean water. Marginalized communities living in unauthorized colonies and all, they actually they end up using water that's unsafe and leads to a lot of health issues, leads to infections, leads to waterborne diseases, so that there will be an explosion of health issues in the years to come. Now, it also means that insufficient water supply also means that we can't really maintain any of the public facilities that we have. So none of the toilets can be clean, none of the toilets can be maintained. That's a major problem. Then when there is another bigger issue, when there isn't enough water, sewage system starts to fail. And that increases the risk of many diseases like cholera. Now, there is also a social and economic impact of this. There will be increased illness due to poor hygiene and due to higher poor sanitation. This will lead to higher healthcare costs for practically everybody, both individuals, state and insurers, and everybody will be affected by that. Then there will be frequent illnesses that will impact productivity because people will not be able to come to work anymore. Then the dependence on water tankers will actually impact the pockets of the families because those are both unreliable and they'll be extremely costly, and this hits the marginalized communities the worst. So generally what happens in any of these situations is those who are at the periphery of the society, those who are the lower you go in the society, the more impacted they are by these things. Now, what are the solutions to address water scarcity? First and foremost is water conservation management. Recently, the Delhi government ordered a crackdown on water misuse. They authorized inspection teams to find offenders, those who are, say, washing their cars with pipes and, using things like that, or allowing tanks to overflow. Basically, the daily habits that indulge result in extremely wasteful usage of water, and they just very unthinking, callous use of wastage of water. The government basically said they'll be cracked down on this and people will be fined. The teams are also authorized to disconnect illegal water connections at construction sites or commercial establishments, and to stop waste discharge from entering Yamuna. The National Green Tribunal and the State Pollution Board need to take some initiatives. And then water rationing strategies must be put in place in summer. When we are entering summer, it's important that before the problem starts, we have water rationing strategies. Now, technological interventions are also possible. The DJB, in collaboration with Hitachi India, is using field centers and smart meters at the Pithampura Water Distribution Network. This would help in This will actually enable remote and real-time monitoring, and it will also help in control of the plant operations. So this is what has been done. These are other things that can be done. Infrastructure development, the DJB, they're suggesting, needs to be more commercially oriented, and customers, that is households, businesses, industries, should be ready to pay more for real cost of supply. But this would actually again hit the marginalized communities in terms of their ability to actually consume water. I mean, they need water, but this is one of the suggestions that has been made. Now, policy and governance reforms, that is another thing that can be done. State and city government should consider water availability in the region while creating city plans and providing permits for new establishments. This has not been considered. This has been a problem throughout the country, where we have just allowed urbanizations to happen and cities to come up everywhere without actually considering where the water is going to come from. For example, even Bombay has the same problem. They don't really have drinking water. They draw it from other places. Same thing with Delhi. We are just growing as a city, not realizing that there is only so much water, so much land, that's actually so many number of people that can be taken care of in this city. Those can actually live in this city. So that needs to be considered. And in some of the cities, like say Bangalore and Madras or Chennai, what has happened is a lot of the lakes have been turned into apartment complexes. So that is an entirely different problem again, and that has actually compounded the issue in those cities. Now, they must restrict any development activities that are not sustainable in terms of water management. So we should have put this into place a long time ago. Now, there should be community participation in water harvesting. Delhi water harvesting potential, it amounts to a staggering 907 billion liters every year. This would really be quite helpful if we could, put this into place. Now, to effectively implement rooftop water harvesting, that is one thing that can be done. Various awareness campaigns can be organized at the community level. So these are some of the things that can be done. Now, coming back to taking this idea forward, over 4%, now let us take a look at, this was about Delhi and what can be done in Delhi. But like I said, the problem needs to be contextualized in terms of the entire country and also in terms of the global patterns that are happening and how it impacts us. Now, if you take the entire country, over 4% of India's rural population is forced to drink contaminated water. That's a huge number of people. Now, what are the 5 worst states in access to safe drinking water? Please do remember these things. These are the kind of things you can actually use, and sometimes they can also appear as questions in multiple questions in prelims and things like that. But otherwise, if you're writing an answer, these are the kind of data points that you can use to substantiate your positions. Now, in terms of 5 worst states in terms of access to safe drinking water, Rajasthan, this is population in terms of lakhs, 508 lakh people population, 82.7 lakh people don't have access to clean drinking water. West Bengal, it is 78.5 lakhs. Bihar, it is 49.3 lakhs. Punjab, it is 42.9 lakhs, and Assam, it is 33.4 lakhs. So remember this map. This is where these are the 5 worst states in terms of people not having access to clean water. Now, this is another thing you should remember, or at least keep at the back of mind. Falling water level across the country, how it's happening across the country. Punjab, 52% of India's wells have shown a fall in water level. That's a pretty big number. Now, Punjab has 84% of the wells in Punjab are showing a fall in water levels. For example, I'll tell you, in parts of rural Andhra Pradesh, say about 30 years ago, you would find water at 30 feet to 40 feet. See, this, I'm talking about, say, 40 years ago. In this, I'm talking about rural Andhra Pradesh. In the same places, I'm talking about, say, Chittoor district, for instance. The same places now, water is available at 1500 feet to 2000 feet. This is how serious the situation is. Now, coming back, Uttar Pradesh has 83% of wells are showing a decline in water. Jammu and Kashmir is 81%. Jammu and Kashmir is actually one of the states that are supposed to be better placed in terms of water, but even they are showing a fall in the water levels available. Chandigarh is 78%, Himachal is 76%, Delhi is 76%. So these are the places where the amount of water available in the wells is falling. So Uttarakhand 71%, Tamil Nadu it is 60%. So this is a decadal average, and this is where things are right now. Now, this is another important thing. 54% of India faces high to extremely high water stress. Now, 16% of the country is drought prone. Now, if you look at this map again, if you see extremely high, so this is the region I was saying, even at the beginning we saw in some of the other maps that this is the region that actually has very severe water stress. They really don't have enough water, and this is only going to get worse in the times to come. And Delhi is somewhere in this region, right? That's where it is. Now, there are hardly any places where the water stress is actually manageable. Coming back, 50 million people in the country are exposed to drought. 68% of the sowing area is subjected to drought. Now, that is again a very, very serious issue, because this is going to hit practically the entire country. 75% of annual rainfall is concentrated in just 3 to 4 months, that is 100 to 120 days of the southwest monsoon, which is to say the rest of the year we really don't have much rain. Now, 35% of the areas received rain between 750 to 125 mm, and but that is just 35% of the area in the country is drought prone. 33% of the country receives less than 750 millimeters of rain and is chronically drought prone. So this is really very serious. Now, this is where we are using water. 85.3% of the water is used for irrigation. 6.5% is used for others, 6.3% is used for domestic, 1.3% is used for industry, and 0.3% is used for energy. Now, if we see the water reservoirs in the 15 states, in the past 10 years, they have been below normal levels. So, these are the several sources of water we have. We have water reservoirs, we have lakes, then we have rivers. So this is where we are getting the water from. Now we already saw that water levels in the wells are falling very severely across the country. Now, if you talk about water reservoirs in the state, some of the states, they are very important, especially in states like Karnataka and Andhra Pradesh. They have elaborate networks of lakes that used to be interconnected, where water from one lake would overflow into the next reservoir, and then it would go on to, so it used to be, it would like fill one, the overflow would fill up the next one. So that's the way it was. All those have been disrupted completely. So if we see the past 10-year average, Uttar Pradesh, Bihar, Karnataka, Andhra Pradesh, they all have 33, 40, these are all minus 28%, minus 50%, minus 30%. These are all much, much below what they have been in the past. So water reservoir levels, water in the reservoirs is really falling. So that is another serious problem. We are losing our sources of water. Why is there the water crisis in the country? We discussed Delhi, but if we talk about the entire country, because like I said, let us contextualize the problem. This will allow you to actually approach this idea much better. If you see, there is a delay in monsoons and change in the monsoon patterns. This is an inevitable outcome of climate change. Now, there is mismanagement in the demand and supply of water requirements. Like I said, 33% of water is being wasted by everybody every day. Billions of liters of water are just being wasted by everybody. There is careless and over-exploitation of naturally available water resources. Unprecedented heat waves. They'll become more persistent in the years to come. That is another major reason. Reduced pre-monsoon rainwater due to weather variation. Depreciation in the water reservoirs levels is also a serious concern. Change in land use patterns has actually had significant impact on water availability. Like I said, in the case of cities, for example, lakes have been turned into apartment complexes. That's a very, very serious problem. There is rapid deforestation. That is one of the most important reasons that is adding to water crisis. Now, how is the future going to be for the country? Now, just in a time of 6 years, we are already in 2024. By 2030, if you can see the red areas, they have very high water stress forecast, which is to say 40 to 80%, and the darker red more than 80%. So if you see most of the country, other than the coastal regions here and a few parts inside the country, let us not get into the exact places, we don't have time for that. You can see most of the country is actually going to come under extreme water stress by just 2030. Now, what has the world been like in terms of water usage over the past, say, 50 years? Over the past 125 years, for example. Most of the water has been used by agriculture. Now, if you see, water is extracted, and this is the water that's actually consumed. So there is a gap between that. Now, that water basically is the water sometimes that's recycled, reused, and returned to the land, and sometimes that is completely lost. So if you see, that has increased. The amount of water that we are drawing and the amount of water that's being wasted has increased over a period of time in just agriculture alone. So we have agricultural needs. Our populations have exploded actually in the past 100 years. For example, take our own country. In 1947, we were just 300 million people. Now we are 1.42 billion. Naturally, the demand in agriculture is going to go up, and demand in agriculture means that we use more water there. Now, the other thing is domestic use. Domestic use, you will see that the maximum amount of water is wasted in domestic use. Now, the third major use is in industry. Again, you will see industry, there's a lot of water that's actually wasted. So, globally, this is how the patterns are. Now, India is on the verge of water scarcity. Like I said, if we fall below, right now, like I said, 1036 cubic meters of water is available per person, which is barely above the scarcity level of 1000 square meters, cubic meters. Now, if you see, these are the light green is the stress areas, and the brownish colors, the light colored ones, they're the scarcity areas. So we are actually moving from this into this. And if you see in the case of Pakistan, they've already entered a situation of water scarcity. The rest of the world seems to be doing much better than us. And we don't want to end up like, Saudi Arabia or like, many of the African nations or Saharan and sub-Saharan African nations. So this is just in the near future. This is already where we are. We are on the verge of actually water scarcity. Now by 2040, that's like we just described 2030. Now let us see by 2040, this is where it's going to be. Water stress is going to be extremely high. Like I said, you can see almost from the entire Middle East, the Arabic Peninsula, all the way up to Pakistan. There's going to be extremely high water stress. India is going to be in high water stress. China is going to be in high water stress. This also means that we'll end up with water conflicts with some of the countries. We already have water disputes with China. We have water disputes with even Bangladesh. So this is where this is going to be by 2040. Now, Global water consumption patterns. You can see the world consumption patterns. Most of Asia has actually consumed more water. There are just more people in Asia. So this is where the situation is right now. So there are 25 countries that are currently under extreme water high stress. A country, when it faces extreme water stress, it means that it is withdrawing at least 80% of the water that's available. 80% of the water supply that's available, when a country draws it out, it means that it's actually in water, there is a extreme water stress. And when it's withdrawing 40% of its supply, it means there is high water stress. Now, 25 countries are exposed to extremely high water stress annually. What are the countries? So these are the countries that have, they have basically about 25% of the world's population, and they currently have extremely high water stress annually. So you have Bahrain, Cyprus, Kuwait, Lebanon, Oman, Qatar, UAE, Saudi Arabia, Israel, all the Middle East countries, Egypt and Libya, Yemen, Botswana, Iran, Jordan, Chile. Chile is the only one in South America. Then San Marino, Belgium, Greece, Tunisia, Namibia, South Africa, Iraq, India, and Syria. So in terms of population, we are the largest country that has come under water stress. So the water problem that you're seeing in Delhi, the water scarcity, it's a problem that is affecting the entire country, and not just the entire country, but the entire world, specifically these 25 countries. Now, just to wrap up, at least 50% of the world's population, that's around 4 billion people, live under highly water stress conditions for at least 1 month every year, which is almost like saying for a month, you don't get water to drink. Thank you. I hope this lecture was useful. We'll meet again, and best of luck for your preparation.